patient came in the very serious condition in the emergency. She was diagnosed with the carcinoma of upper rectum, and that she was diagnosed 20-25 days back only, but still she was not receiving any treatment for that. So suddenly she developed subacute intestinal obstruction. She went to different hospitals of the Siliguri, even the big hospitals of the Siliguri, but she didn't receive any proper treatment there. So one person suggested me in this hospital. So they came to me at 9 p.m. in the night in the emergency. Our RMO just received them. I came and just saw her, and by just examining and going through all the reports, I counseled the relatives of the patient that we can treat her, but we need more investigation to be done. Then we did CT scan of her abdomen, first thing. Then we started resuscitating her. We kept her in the ward for 1 day, then investigated her properly. Then resuscitation was done. While resuscitation and investigation, we came to know that she has a severe heart problem. Her valves are not functioning well. So obviously the further treatment will be always being a challenging thing. So we took the help of our cardiologist Dr. Vasu Majumdar and the physician Dr. Rajni Agarwal. So they recommended some tests. We did some tests. Then we counseled the patient. We told them the proper planning, what we are going to do in 2-3 days is how the treatment will be moved forwards. It was always a very risky thing to go ahead, because the surgery was challenging and the post-operative care was also very much challenging. We just explained the relatives that she needs ICU care post-operatively. Survival is very low during the surgery also. There was chance of death during surgery also, because it was a long duration surgery and anesthesia would have been long, and she was suffering from some cardiac problems also. We explained them how we will go for the surgeries. We are having different options. If she would have been a younger age group, I would have removed the whole of the cancer and anastomosed the intestine, and she would have passed stool not in normal way. But in view of her age as well as different multiple problems like the cardiac problems she was suffering, we decided to go ahead with the Hartmann's procedure. During surgery, the first challenge was the anesthesia. Our anesthesiologist, Dr. Madhu Sarma, he gave the anesthesia and we started the surgery. When we started the surgery, we saw that the tumor was very big, and it was the lymph nodes were also enlarged, so the tumor must have spread to the lymph nodes. So we started removing the tumor portion at the rectum as well as some of the sigmoid colon. And I removed all the lymph nodes of the IMA lymph nodes. I removed all the lymph nodes, and then there was 2 decisions to be made during the surgery. That was a dilemma whether we should go and resect the tumor as well as some part of the colon and anastomose to them. But there was a challenge that patient will not be able to take another surgery afterwards or prolonged anesthesia. So we took the decision of just removing the portion of the tumor as well as some part of the intestine, and we made the permanent stoma, that is the colostomy, for her. In the post-operative period, we kept the patient in the ICU for some days. Our intensivist kept a very close look on the patients so that she get recovered very well. In elderly patients, their physiological reserve is very poor, so their physiology changes very quickly. Sometimes the urine output get decreased, her potassium was decreased, but we kept managing them. We kept them. Take her out of all this scenario. In 3rd day, we start giving her food. Her stoma start functioning. Stool was start coming. She was mobilized on the 3rd day. By 5th day, we brought the patient to the ward. Now she was comfortable. She was passing urine normally. She was taking orally. She was moving around. Now slowly we gave rehabilitation. We kept bring her into the rehabilitation scenario. Now on the eighth day, post-operative eighth day, we discharged the patient, very stable condition. Now she is taking orally normal diet. She is taking her colostomy is functioning very well. She is passing urine, and the relatives were very happy that they were thinking that her patient will not survive long. In fact, they were thinking that they were in very big dilemma whether to go ahead with the surgery or not, because I asked them to give a consent for the high risk procedure, but they took the decision. That was a bold decision. They kept faith in me. I'm thankful to them that they kept faith on me, and finally we were able to remove the tumor, and now she is normal, back to her home. Only thing is that she has to be kept in the follow-up scenario every month, for some days, some months. Then after every 3 months she has to come and meet me. We will keep on doing the test for her, and we will keep a close look on her, because she is having very much cancer has been removed, but the cardiac problems in the post-operative period, we have to keep a close follow-up of her, so she will survive normally.
मेरो नाम गजेन छेत्री, दार्जिलिङ सोनादा। मेरो आमा आजभन्दा 1 साल पहिलादेखि नै मतलब पेटको रोगले त्यहाँ सताइरहेको थियो। तर त्यतिखेर पनि मैले अब हस्पिटलहरूतिर 15 दिन एडमिटहरू गरेँ, राखेँ। सबै डक्टरहरूले नर्मल छ, तपाईँ केही चिन्ता गर्नु पर्दैन भनेर भन्नुभयो। फेरि घरमा लग्यो, फेरि त्यस्तै टोइलेटहरू मतलब त्यस्तै खालके आउने, पेट दुख्ने, यताउता हुने। त्यहाँबाट त्यसो हुँदा हुँदा साल बित्यो। बित्नुको बादमा लास्ट इन्डिङमा जब आमालाई टोइलेट नै बन्द भयो, त्यस कारणले हामीले इमर्जेन्सी दार्जिलिङ हस्पिटलमा लगेर आमालाई एडमिट गरेर राख्यौँ। राख्दाखेरि वहाँनिर मतलब डक्टरले भन्नुभयो कि आमालाई अब यो ठिक हुने बिमार होइन, लामो दिन जाँदैन। त्यसो भन्दाखेरि अब लास्ट डक्टरले भन्नुभयो अपरेसन गरेर नै आमाको त्यो अब के अरे त्यो हावा भरेको के कसो यता भन्नुपर्छ। तर अपरेसन पनि यो बुढेसकालमा 75 इयर्सको एजमा यो सम्भव हुँदैन। त्यस कारणले चाहिँ हामीले त्यहाँदेखिको रेफर मागेर चाहिँ सिलिगुडी ल्यायौँ। सिलिगुडी ल्याउँदा पनि हामीले मतलब 2-3वटा जग्गामा आमालाई घुमायौँ, मतलब एम्बुलेन्समा। त्यतिखेर मतलब आमालाई जो यहाँनिर मतलब यो ओन्कोलोजी फेसिलिटी छैन भनेर त्यो हस्पिटलहरूले मतलब मना गरिदियो। त्यस कारणले हामीले लास्टमा एउटा हस्पिटलमा गयो, त्यहाँ पनि ओन्कोलोजी छैन भनेर बतायो। उसको बादमा हामी परेसान भएर चाहिँ अब हामीले 3-4 जग्गा घुमाइसकिसक्यो। एक त पेसेन्ट यस्तो स्थितिमा छ, त्यस कारणले चाहिँ अब यहाँबाट चाहिँ हामीले कहाँ लानुपर्ने भन्दाखेरि चाहिँ एउटा अलिकति राम्रै मान्छे भनौँ, डक्टर भनौँ, उहाँले नै यो हस्पिटलको यो महाराजा एग्रेसन हस्पिटलको नाम लिएर चाहिँ एड्रेसहरू पुरा दिएर चाहिँ यहाँनिर पठाउनु भयो। जब हामी राति करिब हामीहरू 9 बजे करिब यहाँ हस्पिटलमा आइपुग्दाखेरि डक्टर साहब पनि त्यतिखेर यहीँ हुनुहुँदो रहेछ, डक्टर विशालज्यू सर। तुरन्तै उहाँले इमर्जेन्सीमा लगेर यताउता आमाको त्यो एडमिट गरेपछि हामीलाई पनि ढुक्क भयो, ताकि आमाको त अब के भन्छ आमाको लाइफ चाहिँ हामीलाई छैन भनेर त पहिलादेखि नै थाहा थियो। तर पनि डक्टर साहबले हामीलाई यसको आश्वासन दिनुभयो कि अहिले तिमीहरू चिन्ता गर्नु हुँदैन, कतिपय अहिले एडमिट भइरहेको छ, हामीहरू 1-2वटा टेस्टहरू गरेर चाहिँ बताउँछ भनेर भन्नुभयो। जब 2 दिन यहाँनिर आमालाई एडमिट गरेर हस्पिटलमा यहाँनिर राख्यो, उसको 2 दिनको बादमा सबै रिजल्टहरू एमआरआई, सिटी स्क्यान, अरू के भन्छ यो चेस्टको एक्सरेहरू सबै गरेर पत्ता लागेपछि चाहिँ आमाको पेटमा चाहिँ एउटा क्यान्सर टाइपको ट्युमर, ठुलो ट्युमर छ भन्ने चाहिँ कुरो थाहा लाग्यो। थाहा लागेपछि डक्टरले भन्नुभयो आमाको एज त निकै पुगेको छ, यो अब हामीले सक्सेस हुन्छ भनेर भन्नु पनि सक्दैन, तर यो अपरेसन नगरे पनि नहुने। अगर बाइ द वे आमाको यस्तो बिमार चाहिँ अरूतिर भएको भए चाहिँ हामीले अपरेसन गर्ने थिएन, तर पनि नगरी नहुनको कारणले हामीले घरतिर सल्लाह गरेर घरको पुरै परिवारहरूलाई यहाँ बोलाएर सरसल्लाह गर्दाखेरि चाहिँ हामीले अपरेसन गर्ने निष्पक्षमा पुग्यौँ र यहाँ एडमिट भएको 3 दिनको बादमा डक्टर किसानदेव सरले पनि हामीलाई गार्जेनलाई बोलाएर मजाले ब्रिफिङ गर्नुभयो। त्यो ब्रिफिङ चाहिँ हामीले स्वीकार्यौँ। आमाको अपरेसन पनि मतलब भयो, राम्रैसँग सक्सेसफुल भयो। त्यसमा डक्टर साहबको ठुलो हात छ कि यस्तो एजमा पनि यस्तो बिमारलाई पनि उहाँले सही सलामत अपरेसन गरेर चाहिँ अब आमालाई चाहिँ बचाइदिनु भयो। उहाँलाई मेरो तर्फबाट धेरै धेरै धन्यवाद। साथै यस्तै पछि कोही पुलिसकालमा यसरी हस्पिटलमा कोही आउने मान्छे छ भने उनीहरूमाथि पनि जस्तो मेरो आमामाथि भयो, मतलब राम्रो काम त्यस्तै उनीहरूमाथि पनि होस् भन्ने मेरो एउटा आशा छ। साथै अपरेसन सक्सेसफुल भयो। उसको बादमा आमाको मतलब फेसले पनि राम्रो खालको रेकर्ड गर्नु थाल्यो, फेस उज्यालो भयो। त्यसको बादमा अहिले फिलहाल आमालाई एडमिट गरेको अब अपरेसनको बादमा आमालाई तकरिबन 4 दिनसम्म आइसियुमै राख्ने सल्लाह डक्टर किसानदेव सरले दिनुभयो, किनकि आइसियुमा राम्रो फेसिलिटी छ, सबै देखरेख राम्रो हुन्छ भनेर। त्यस कारणले उहाँकै सल्लाहमा आमालाई 4 दिनसम्म आइसियुमै राख्यो र 4 दिनको बादमा आमालाई जनरल वार्डमा फेरि सिफ्ट गर्नुभयो। अहिले फिलहाल जनरल वार्डमा 3 दिन भयो र अहिले आमाको फिलहाल हेल्थ एकदम मतलब ठिक छ भन्नु त मिल्दैन, तर पनि धेरै बेटर छ र डक्टर सरले भन्नुभयो कि अहिले आमालाई पनि हामीले डिस्चार्ज दिन्छ। डिस्चार्ज दिएपछि चाहिँ आमालाई राम्रोसँगले देखभाल गर्ने, खानापिना राम्रो खुवाउने, एक्सर्साइज गराउने त्यो सल्लाह दिनुभएको छ र अहिले सायद आमालाई घर लगेर जाँदैछ। त्यसको बादमा 3 दिनसम्म हामीले फेरि दुबारा रिभ्यूको लागि यहाँ आउनेछौँ।